All right, excellent. Thank you all for coming this evening. My name is Liz Schenk. I know most of you. I'm a health coach with the hospital, and I help facilitate these classes that we started about a year and a half ago through the Vail Epic Promise Grant. So thank you, Vail, for funding this. It's allowed us to do all kinds of great things with getting information to our community members here. So we have Jonathan Lowe, who's a nurse practitioner. He's fairly new at the hospital. We're very happy to have him. Then we also have Dr. Gail Pritchard, who kind of got brought into our department to help getting things, the behavioral health department, off the ground, but they can speak to that a little bit more as we get going. Again, a couple housekeeping rules. Go ahead and ask questions through the chat box. They will be private. Only the speakers and myself can see them. And we will unmute at the end and after I stop the recording, so that way if you have questions, you can ask them then. So I'm going to introduce Jonathan, who is he's going to do our initial little presentation. Jonathan graduated with honors from the University of Pennsylvania in 2007, where he earned his MSN in psychiatric nursing. He's received the Connecticut League of Nurses Award and the Joan Lenau Award for Outstanding Clinical Scholarship. And I'm just going to read Dr. Pritchard's bio as well right now, and then we'll get started with the presentation. Dr. Gail Pritchard is a psychiatrist. She joined the Tahoe Forest medical staff following her retirement after 28 years at Stanford University in 2014. She's currently the medical director of Tahoe Forest's Behavioral Health Department. She's worked behind the scenes to help build this program. Her passions include anything outdoors in the mountains, spending time with family and friends. Her approach to psychiatry is holistic, honoring and encouraging each person's unique strengths and capacities for wellness. And I have to say what I know both about these two wonderful people. We're very grateful to have them as a part of our growing behavioral health staff and program. On that note, Jonathan, I'm going to turn it over to you to start your presentation.
Thanks for allowing me to host this quick talk. I will try and kind of move through these slides as quickly as possible, making sure that I'm giving you the most important information along the way. So let's just move right into transitioning to our new normal. And we're going to start off by talking about the neuroscience of adaptation. Working with this wonderfully complex organ every single day here at the office, it never ceases to amaze me, fascinate me, what we learn about it as the years go by, what we thought we knew and we now know is different. And one of the more recent areas where we've made some headway in understanding the human brain is through this idea of adaptation. So adapting or being very adaptable is, of course, a very highly efficient way for us to stay alive as humans. When we are born, our brains are really built, right, to take in a lot of information and to be pretty flexible in terms of the information it's taking in, because we're hit with all of these new experiences. However, as we develop, we find that we also have to, at the same time, become less flexible and able to absorb a lot of new information at the same time. And that's because of efficiency's sake. If I had to wake up every single day of my life and figure out how the world works and figure out how to walk and how to talk and what's safe and what's not, we wouldn't be here today if that was the case. And so along the way, as our brain stops being as malleable and flexible as it once was when we were children, we make these hard-line judgments that kind of burn into our brain. And for the most part, this is a really wonderful survival mechanism that we have up here. Where it becomes difficult are in times like this. During COVID-19, I, like many people, and certainly all of the folks that I work with here in the office, struggle with that sudden shift in routine. This is a really, kind of interesting time in our lives. We are all, for the first time in our lifetime, facing a global problem on a scale that none of us, nobody in the world has ever experienced. And we're learning a lot, I think, about our mental flexibility and our abilities to adapt. I think we're learning a lot about ourselves. I think we're learning a lot about one another. And the the anxiety that we feel when we are forced into situations that cause us to change can keep us from going through with that change. And typically, this is what anxiety does. It's meant to be a protective hormone for us. So if I'm feeling really anxious, that's my brain's way of telling me to be on alert, to be cautious, to be careful. And if that anxiety gets high enough, I might not move forward at all, even though logically I might know that the next step I take is the right thing to do. My anxiety might be telling me otherwise. And certainly right now, I think all of us are experiencing some sort of change in terms of our emotional response as our typical daily routines get kind of pulled out from underneath us. So the important thing too is to know that even though we kind of hardwire these routines into our brain, one of the wonderful things that we've really learned more about in the past 2 years is the ability for the brain to learn flexibility, to be able to take some of those kind of hardwired anxieties or hardwired routines that we're used to and shift them. And this is a very, very important concept, of course, while we're all living with COVID-19. And one way to understand this, and there's lots of different ways, believe me, that we could talk about this, but I picked one primary way to help us understand, and that's through what's called the locus of control. So locus meaning point or place, right? Position. The locus of control, or the position of control, or the point of control, is a measure that was developed in the 1950s, and we still use it today. I use it a lot with my patients here. And it helps us to understand a part or a key part of our personality and its ability to be flexible. And where it comes into play is that there are two spectrums of the locus of control, and we'll go through an exercise here that you can all participate in a moment. There's external at one end and internal at the other. An external locus of control is basically the belief that not much of my life or what happens to me in life is under my control. This is typically what we see, again, during that developmental time when we're younger. Often kids have a much higher external locus of control. As we develop and as we mature, most of us, as we shift into adulthood, will fall more on the internal side of the locus of control. Internal being that I believe that my choices are the main drivers in what happens to me. And while internal locus of control are in general thought to be healthier personality traits for us, they can really stand in our way when we are faced with situations that are outside of our control, because that's where the anxiety comes from. It's suddenly something that I felt was under my control, and that helped to calm my anxiety is no longer there, and so the anxiety increases. And then, of course, come our thoughts and behaviors after that. And a way of, maybe thinking about this, I tried to imagine another way of events affecting this part of our brain, or this pattern in our brain that's so heavily influenced by the locus of control is the following. So imagine the event in the picture that you're seeing there is that we go to the zoo and we are standing in front of a lion's exhibit, right? So we're looking at a lion at the zoo. That's the event. Now, there's a couple of different ways this event can be processed. The event can be processed of, okay, I'm here at the zoo, I'm looking at a lion, and maybe it's thrilling, maybe it is sad to see the lion in the cage, maybe it is a little mixture of both. It doesn't need to be black or white. And that's the thought that is caused. And then my feelings that are caused by that thought might be feelings of excitement or joy or sadness, again, for the lion, maybe, or for the tiger, or maybe a mixture of all of it, right? Or that same event of us standing in front of that the tiger's cage could lead us to an imagined event. What if the cage just suddenly opens up, right? So what if that cage suddenly opens up and that leads to thoughts of what would happen to me? Where would I run to? Do I need to leave? Am I safe? And those thoughts, of course, lead to feelings of panic, anxiety. And so you can see how this can shift in very, very different ways, even though we might be having the same exact experience. And a lot of imagined events come from that higher external locus of control, because we spend a lot of time thinking about all of the things that are outside of our control, which to an external locus of control is mostly everything, and all of the different possibilities. And typically, that leads to higher rates of anxiety and depression for us. However, again, on the other end of the spectrum, even though internal locus of control may have a lower level of anxiety or depression at baseline, when faced with certain situations, it becomes really, really important that we understand that component of our personality and then understand what we do have control over and work towards taking control over those things in order to help our anxiety calm down, in order to help us think. So this is a really, really brief exercise. Locus of control, depending on which scale you're using, can be 13 to 28 questions. I will give a link to the actual locus of control test you can take online if you're interested that will score you at the end of the presentation. And this will all, again, be saved. So if you want to go back to the slides or look at the slides later, you'll be able to do so. So where do you land? And the way the locus of control test is administered is the following, is that I'm going to read two statements to you, and you are going to pick the statement that you believe to be true, right, or to be more true. You don't need to overthink it. You just kind of go with your gut. You know, if you're kind of split between the two statements, you go with the one that has 1% higher, feeling that you think that statement is correct. So the first set of statements. Many of the unhappy things in people's lives are partly due to bad luck. That's number one. Or number two, people's misfortunes result from mistakes they make. Which one do you agree with more, one or two? If you said two, you get an X under internal. Next set of statements. In my case, getting what I want has little or nothing to do with luck. Many times we might just as well decide what to do by flipping a coin. Again, which one of those statements do you agree with more? If you thought number one, you're going to give yourself another check under internal. Last set of statements. What happens to me is my own doing. That's number one. Number two, sometimes I feel that I don't have enough control over the direction my life is taking. One or two, what do you go with? All right. And so think about where you land on that spectrum. Did you answer all the questions, so your X's landed on internal, or did none of your answers land on internal and you're more on the external side? Are you a mixture of both? Most of us are. And we used to, again, think that this was a static part of our personality, that you were born with a specific personality or you landed on one side or another, and that your progression was going to be what it's going to be, but it wasn't necessarily going to be influenced by anything else. We now know that our experiences as we grow up have a huge impact on our locus of control. And even further than that, we now know that our locus of control can change throughout our whole lives. It gets maybe a little bit more difficult as we get older, and some of that neuroplasticity slows down in this organ, and we become less mentally flexible. But we know that there are specific ways that we can actually foster a higher internal locus of control. And again, there are many ways that we can do this, but I picked one in particular that I think is helpful during this time of COVID-19. And that's through meaning and acceptance. So again, my own theoretical framework in providing talk therapy to patients when I do is really informed by CBT and existential therapy. So I am what's called a cognitive existential therapist in terms of the way that I try to help people understand how their brain works. And here's a great quote from one of my favorite therapists, father of existential crises, Viktor Frankl. The quest for meaning is the key to mental health and to human flourishing. And when we think about meaning and its importance and how it ties in to mental flexibility, the ability to accept what's going on in our lives, and how that plays into locus of control, we need to understand that making meaning is one of the few things that we get to actively be involved with and own, our whole lives. There's many of the things, and again, we're learning this right now, many of the things, if not all of the things in our lives can be taken from us. except for perspective. Right? Perspective is something that we ultimately get to have control over, and it has a huge impact on the health of this organ. And specifically, there's a part of the brain called the default motor network. This is a part of our brain that gets activated, if you will, when we're daydreaming. And we actually spend about almost 50% of our waking hours daydreaming, right, where we drift off from what is happening in front of us, where we drift out of presence into these other spaces. And we have recently, especially in the past 2 years, learned what an important role that the default motor network plays in mental flexibility and in locus of control. And one of the ways that you and I can really influence that default motor network, there's a few, but a couple that I'll share with you. One is through meditation, and two is through storytelling. And again, going back to the importance of perspective, it's the ability to tell stories even to ourselves of what is going on in our lives. And the language that we use when telling those stories has a huge impact on our emotions, and those emotions then have a huge impact on our thoughts and behaviors. Again, going back to the example from a couple slides ago, when we were standing in front of that tiger's cage, if I tell myself the story that, that this experience of standing in front of this cage may end up with me losing my life, my brain is going to react naturally by trying to protect me, and it's going to try and protect me by flooding me maybe with anxiety, right, to get out of the situation. And so that storytelling has a really, really large impact on us. And so think about that if you're struggling right now, especially as we're being told stories, right? We're watching, maybe global news, and we're watching a lot of things that just seem out of our control because many of them are. And how is that impacting the story that we're telling? Are we starting to tell ourselves more stories of fear and hopelessness? And then, again, how can we redirect that? A couple things to think about or to consider if you are struggling in that area would just to be, taking a bit of a world news break, right? Really slowing down and focusing on, first off, what's happening with me. And then from there, what's happening in my household. And then from there, maybe what's happening in the town that I live in. And then stop there, right? I can guarantee you that if there's any real big news happening, you're going to find out about it anyway, one way or another. But by decreasing the amount of stories that might be causing us fear due to our lack of a sense of control, we can help to decrease that anxiety. This is also something simple that you can engage with if you have children in the home. You can watch, say, a movie, because most children's movies usually follow a theme of there's some sort of difficulty that needs to be worked through, and by doing the work, there's a positive outcome. And so rather than just shutting off the movie and moving on to the next task, have a conversation with your kids. Ask them, what did you think? What were some of the problems that the protagonist or the main character faced? How did he or she get through those problems? What would you do in that situation? And again, this storytelling has a really big impact on how they ultimately understand their own role and their own destiny and help them manage their anxiety. Be careful about the conversations that we're involved with one another or our family members, making sure that that we aren't trying to kind of predict this anxiety-provoking future that is outside of our control, and that's the main topic of discussion, but rather really honing down and focusing on what actually do we have control over. Another example I thought of when thinking about meaning and acceptance and the power of storytelling on the brain was a study that I was actually involved in my early 20s. It was after 9/11. Again, this kind of shared, really intense, traumatic experience. And the department I was involved with had myself and my peers go and reach out to a population of 75 and older in the community to share our stories with one another. And this may be another area where we as a community or we as families can come together, is to look to older generations Ask them about similar situations or situations of struggle or strife, and what were those like? How did they get through? What did they do? Hearing those stories has a huge impact on our brains, but also telling them has a huge impact. And so that might be another trick that you want to try, and just see where it leads you. See where it may be, again, if you have kids and their grandparents might be able to tell them a story about struggles that they faced, how they got through, and that will help them to understand their own struggles. The other thing that we can do is what's called a making meaning intervention. And this is a really simple intervention to do. This intervention actually was originally designed to help with, as a group therapy exercise for cancer survivors. But I think it's a particularly helpful tool or strategy to use in a time like this when we're living with COVID-19. Making meaning intervention, it's really just asking yourself, and taking inventory in three main areas. First, let's think about the present. I mean, what have we lost, right? We all, every single one of us has absolutely lost our routine, that's for sure. Some, myself, early on in this, crisis of ours, I lost a coworker. Right? We've lost the ability to be around our friends and loved ones as often as we would like, or in ways that we're used to. Some people have lost jobs. Some people, have had to change their jobs so radically that, again, that they've lost maybe that typical routine that they're used to at their place of employment, and that's anxiety-provoking. And once we kind of inventories, and I would encourage you just to sit down and just think about these things and write them down, right? What have we lost? Now I want you to think about what do we have control over? And for my high internal locus of control people here, we don't have control over a vaccine. We don't have control over the progression of the novel coronavirus. But take control of the things you do. Have the power to manage. And that could be wearing a mask. That could be social distancing. That could be washing your hands more often. These are things that we absolutely can control. We can't control the behaviors of other people, but we certainly can ours. And then after you kind of make an inventory of what things can you currently control, I want you to think about what positive experiences can be had right now. And this might present an opportunity for some people to get really, really creative. I've certainly seen this in houses in my own neighborhood in terms of how they are connecting, with the neighbors around them in a way that is safe and responsible. I've certainly seen this in the taking on of new activities. My family, for instance, we have begun hiking on a regular basis and learning about the flora and the fauna of Truckee. And I'm not sure we would have done that if we weren't in this pandemic, but it's something that we have found to do, and we found that we've enjoyed. You also kind of see that positive experience in what we have control over. You see that in so many ways, not just with ourselves and changing our routine, but if you think about the local businesses around here, right? What they lost was the ability to do business as usual. And then, okay, what do we have control over? Until we loosen restrictions, maybe not much, but when restrictions are loosened, now I have control over this piece. And we've seen this with a lot of bars and restaurants that have changed the way that they've done business, right? They realize, okay, maybe I can't do business as the way I usually would, but I can have outdoor seating, or I can do takeout food to help feed the community, or that there's a local brewery around here who started making hand sanitizer, like taking control over what we have control over, and thinking about how can we make and create positive experiences during this time. And then after that, think about your past. And this is where, again, storytelling becomes really important. How have you coped with previous negative experiences? We've all had them. It comes with the package. How have you coped with those? Think about it, write it down. Again, this is another great one to ask your kids if they're feeling anxious. Ask them about things that upset them or that they struggled with in the past. And then ask them to tell the story of how did you get through that? What did you do? Right? And then think about the future. That's the final piece, right? What are your goals, and how can you continue to work toward them? So it's not that we need to let go of the goals that we once had because everything's changed. We just may need to shift and modify them. And again, what this does is really foster a much healthier story, which fosters a much healthier default motor network, and that will in turn influence that locus of control and make sure that not only are we shifting into a higher internal locus of control, but we are actually taking over and taking control over the things that we truly can control. And again, I know I had to blow through these because of the technical difficulties at the beginning, which I think is hilarious based on the topic. I think it's wonderful that we had all those technical difficulties and we're able to work through them together. But I do want to give a list of resources out there to the community. The Behavioral Health and Psychiatric Services here at Tahoe Forest Hospital, the number's right there. I have the link up also if you are interested in taking that locus of control test, and so you can be scored. And if you're struggling, right, if you're having difficulties, there are some other resources on this page that may be able to help you, right? Reach out, reach out to us, reach out to your community if you have concerns about your mental health or your mental well-being during this time. Call the office. We would be more than happy to sit down and talk with you, whether it's over the phone, in person, over Zoom. We're here to help, and I appreciate your time. Thank you so much for having me.
Thank you, Jonathan. Dr. Pritchard, do you have anything you want to add right now before we go into questions?
Well, I certainly enjoyed every word of your talk, Jonathan. It was inspiring. And it makes me think of those of us who choose to live up here in the mountains. I think we tend to be athletic, outdoorsy types. Maybe not everyone, but it's kind of a bit of a cultural norm up here. And I think as such, we may be more vulnerable to our bodies responding to what our mind is thinking about. So where our mind goes, our body follows. That notion of storytelling, or the concept of storytelling, is so vital, because our bodies and our emotional center, our reactivity, listens to what we're thinking about and the thoughts that we feed. So, again, taking control of what we feed our mind in terms of how we're thinking and framing this experience is so essential, especially to people who have a very powerful mind-body connection, which is athletes. So anyway.
Absolutely. That's perfectly said, and I know that you understand this well, Dr. Pritchard, but I think sometimes the general public has a hard time understanding what we often refer to as mind-body connection. A lot of my patients picture that there's body and then there's mind, right? And I try and help them understand that what we're really saying when we say mind-body is we're saying body and then consciousness, our unique ability to be aware of what's happening with us. Because you have to remember that a feeling is just a physical it's a physical process. It's the physical passing of a chemical, of a hormone from one neuron to the next. It is physical health. And to tie into that kind of that somatic experience that you were touching on, one of the things I always like to do is that it's an exercise where, if you can imagine, if you can all just like close your eyes for a second. This will only take a second, right? If you close your eyes, and if you have metal fillings like I do in your teeth, if you imagine chewing on foil, like just chewing down on tin foil, right? Or, if you're old enough to remember blackboards here, if you imagine the sound, you close your eyes and really imagine somebody scraping nails slowly across a blackboard. That's it. That's all you got to do, right? And then so open your eyes, and most of you probably experience some sort of physical sensation, a tingling in your scalp or your skin, right? An uncomfortable physical sensation. And the fascinating thing about this exercise is that what's happening is that as you are producing that thought in your head, you are causing tens of thousands of what are called erector pili muscles underneath your skin attached to your hairs to contract, all right? So here we are thinking about chewing on tinfoil or scratching a blackboard, not the most traumatic experiences of our lives, and yet we're causing tens of thousands of muscles all to respond at the same time throughout our whole body. That's the connection, right? So when we are telling these stories, when we are eliciting these emotions, that's why it's so important to, again, kind of learn how to unlock the secrets of this organ, take control over what we have to have control over, because it affects so much more than just our feelings.
Yeah.
I want to read a couple questions in the chat box already, so please go ahead and put your questions in there. Remember, the only people that can see them are myself, Dr. Pritchard, and Jonathan, so they are private. So go ahead and type any questions you have in the chat. So the first question we have is, what suggestions does the group have for those who are struggling and were already struggling before COVID hit? So example, multiple deaths in the family, and maybe some mental health disorders to begin with, but before all this started. Dr. Pritchard, do you want to go first on that one?
Well, first of all, my heart goes out to anyone in that, struggle. And just know that you're not alone. There's so many in our community and in our lives who struggle silently. And so it's so great to come forward and start sharing what you're going through, with whether it's with a church community, an AA community, a shared parent, community, or with us here in behavioral health, because we all have different vulnerabilities, and life events trigger these vulnerabilities to be more manifest, more symptomatic at different times, and that's why we're here. So anyone or any one of us shouldn't be alone at any point in time. So I hope whoever is in our community can set that example and reach out.
Jonathan, what would you say to that same question?
So, I second everything that Dr. Pritchard said. I think it's important to remember that the symptoms of diagnosable, anxiety, depression, they are correlated with stress, right? And so the more stress that we have to take on in this organ, the more likely we are to produce symptoms. And if we previously had symptoms, let's say I had depression in my teens, right? And maybe it was treated successfully, maybe I got therapy treatment, or maybe it's cleared, I don't know. I'm always going to be at higher risk for reemergence of that depression for the rest of my life. Almost imagine it kind of like a virus that's lying dormant in your brain. And the way that our immune system goes down in our brain is via stress, right? And that can be positive and negative stress. And so if we were already predisposed or being treated for mental health symptoms prior to, loss of family, funerals, loss of job, COVID-19. Again, these can just pronounce the symptoms even more. And I would just encourage that person or whoever was struggling to reach out to us. There is help out there. We are not alone. One of my favorite things to remind people is that every single one of you listening to this talk today has survived 100% of your worst days on this planet. Those are really good scores, right? Like, you can't do any better than that. And so reminding ourselves that we have and we do have the capability to get through difficulties and life's difficulties. And we also need each other in order to do that. And so reach out.
Right, thank you. Something I see a lot, I work with, I teach the senior exercise classes, and we have participants from all over the world. We have participants with family all over the world. My family's in Michigan and high risk. And there's a lot of fear and sadness around not being able to connect with our loved ones, especially that are out of the area. What would you say to someone that's really struggling with this?
Well, I'm not sure if we can create virtual connections. That sometimes isn't possible technologically. Not everyone has access to these fancy Zoom, where seeing another human face of a loved one can make all the difference in the world. So without that, you know, I often wonder how much we benefited from snail mail. I know that's not really answering the question, but there's something wonderful about pen to paper and writing a story about our lives and even honoring what we miss in that other person, putting it to paper. You know, we may miss the twinkle in their eye or the silly joke we've heard 10,000 times. They always tell at Thanksgiving. But to write that down and to honor each other in a giving way, that I think for any of us to experience that we're seen and known for who we are by another who we love and care about, that's extraordinary and really fills our tank. So for a loved one to be able to read each of our experiences of them and share a bit about ourselves is a very special act of intimacy. And I know it's very old school, but I think it's very important. Also, just on the neuroscience side, taking a pen and writing is transformative. You actually, when you do these biologic studies, you put your head in a fancy like research scanner, you see the hemispheres synchronized and the brainwave pattern go into this more relaxed, meditative delta wave pattern. Transformative writing, pen to paper, is good for our own biology too. So that's my contribution to that question.
Well, that's great. When I first moved to California when I was 19, that was a while ago, I had the letters still. My dad and I would write back and forth, and that just you mentioning that Dr. Pritchard reminded me of that. That's how we communicated if you didn't want to have a giant long distance phone bill.
Yeah, and there's something, like I say, truly transformative about the doing of that and the receiving of that.
When it's something you can hold on to, too, you know, emails and Twitter, it's tangible. You know, I love that. Jonathan, do you have anything to add to that one?
No, I think actually Dr. Pritchard's, you know, I was going to say the same exact thing in terms of letter writing. So first, it's letter writing, and for, you know, if any of my patients are on anonymous, you'll know that if you're struggling with just getting up and doing basic tasks, the first thing I make you do is start keeping a handwritten to-do list. Because we know that just by writing down these tasks, the effect that it has on this organ, where other forms of technology just haven't been able to do that yet, as our brains continue to develop, I imagine they will, that's really important. And so writing as a form of connection, because not only do we receiving the letter feel connected, but the one writing the letter, as they're writing the letter, they start to feel that connection through storytelling, and that is massive. And then, you know, for those of us who have the ability, like, you just find creative ways of letting other people know that you're thinking about them. Like right now, I'm in this, you know, I do want to, I have a shared kind of, Netflix account, and everybody has their own little, icon, I think they're called, right? Picture for their profile. And, you know, every now and then we're playing a game where we go in and we change everybody's icon around to something that we think that they're going to find funny. So I changed everybody in my family here and in Connecticut to a picture of Dolly Parton. And I just let everybody know, like, oh, somebody's thinking of me. Like, there's just these little moments of connection. So I think we just got to get creative with it too, right? We just have to get creative. But I am a huge fan of that letter writing.
Wow, yeah, that's great. I have a comment to read, Jonathan. Somebody mentioned that they loved how you said that remembering that 100% of us, or we have survived 100% of our worst days on Earth, and that was just a really good way to look at it. So just a comment there.
Yeah, I've never gotten 100% on anything, so taking that one.
I like that. And looking at, you know, transitioning to the new normal, there's a lot of things that we can't do. And so in some of the things that I see and even struggle with myself sometimes, you know, when it comes to our health habits, we're used to going to the gym. We're used to, going down to Whole Foods to get, well, we have Rayleigh's now, which is great. But, when you're unable to do the things that you're used to do, sometimes we kind of get stuck in doing nothing. When it comes to, our health habits and taking care of ourselves, when we don't have access to those things anymore, do you have any advice there in helping somebody get unstuck in that area?
Yeah, sure. I mean, I think one of the easiest things to do, again, is to go back to that exercise we were talking about earlier. I think if we just keep the information up here, it can be overwhelming, because it can be a Mount Everest of a situation. But if we just sit down for a moment and we actually write out, what are the things that I miss? What things were taken away from me? Going to the gym, going to Whole Foods, doing these tasks. It's not that I have to tell myself, don't be sad about those things. We should feel loss. We should experience the emotion of sadness for that loss. But then more importantly, again, what things can I do, right? And not to expect that it's going to be what it was, right? But what can it be now? And when I write those things down, when I see them on paper, that can help me understand it in a whole different way, rather than just trying to think about it, which can be overwhelming, and then that leads to more anxiety, which leads to inaction. And if we're struggling even writing down or where to start, I think that's a really good place to tell us, I think maybe I need to talk to somebody. And it might not be Dr. Pritchard, it might not be me, it might not be a therapist here, but certainly someone in my circle of trust. Someone who I can talk to about my thoughts and feelings, that can help just guide me while my brain is in pain, right? Because it's just a physical process we're all experiencing. It's brain pain. And sometimes my pain is so bad that I just need somebody to help me, walk through from this end to that, right? I just need some guidance. I need some help, and it will pass.
Right. Dr. Pritchard, anything to add to that one?
I would add, well, it's not really an addition, but just, of course I concur, and to not overwhelm ourselves with this Mount Everest that can rattle around in our heads. Because I know for me, I may say, oh my gosh, I've got to lose 20 pounds. I've got to get, in terms of my own fitness, and then I'm like, it'll never happen, versus take the first step, walk around the block. Just make it realistic, make the first steps doable. And they lead to the second step, which leads to the third step. So I think just managing our expectations, don't put each of ourselves under too much pressure to get from 0 to 100 right away. Things like that.
This has come up quite a bit. We're looking at friends and families who, or family members who don't want to follow the guidelines and are kind of resistant to the mask wearing and all that. Any advice to those challenges? We want to be able to communicate to our friends and family how this is really important to us, especially those of us with pre-existing conditions. But sometimes those things come up, and we don't want to destroy our relationships, but it's very important. Any advice on how to communicate that to our friends and loved ones who don't want to follow the guidelines?
Super good question. Jonathan, I think in terms of this question about your slide on neuroplasticity and adaptation, how hard it is for people to shift their cognitive set, their mental set, and really accept the situation we're in and move forward with the changes that are required of all of us. It's a really hard thing to do. And as they say, denial is not just a river in Egypt, so I don't know, I'm sure you have more to add to this.
Yeah, I'm just a huge fan of communication. So, I think about it a couple of ways, because there may be things that I do with my family that other families in my neighborhood or even my other families might not feel comfortable with, as there are certainly things that I see other family members doing in terms of maybe the looseness of what they view as the restrictions that they need to keep themselves safe as unsafe. And I think one of the best ways to start is just letting our thoughts and feelings known. Let that family member know how uncomfortable it makes you. And the best thing that we can do in these situations is let your feelings be known. Make sure that it is coming from a place, again, where it's, I'm feeling really uncomfortable. It's not that, I hate what you're doing, or I don't like that you're doing or not doing this. It's that I'm recognizing that it's making me feel uncomfortable. Right? You need to know that. And if you can't change your behavior based on you now knowing how uncomfortable I am when you do those things, then all of us probably have been to a family or a Thanksgiving dinner, and we know that you cannot control, like even family members, right? So we can't control ultimately their behaviors. And again, going back to this exercise and this locus of control, let go of the things you have control over, take control of things that you can have control over. I do have control over who comes into my space, right? And sometimes we don't. Sometimes we have family members living with us, right, who don't follow the guidelines. But again, I have to maintain control over what I do have control over. More frequent hand washing for myself. It might be meaning more cleaning. It might mean more conversations with that family member to help them understand the risks that are going on when they are not following guidelines.
Stop you there for a second.
Oh, no problem. Just help that family member understand the risks that continued conversation, not expecting them to change behavior right away, but that continued conversation about how we're feeling and why this is important. And that can help with some of that cognitive flexibility. I would also engage that family member and again, ask them, this is a great opportunity to ask them, have you ever gone through, like a real big struggle or change like this in your lifetime, to shift focus and get them thinking about a time in their life when something had radically changed and they needed to radically change behavior in order to move through, and maybe that gets the wheels turning a little bit better.
Mm-hmm. Mm-hmm. Right. Well, we have a question. So for extroverts, social distancing is, especially to the extent we have had to do it at home, given this particular person and their daughter are in the high risk category, it's been very difficult for her. The loneliness, despite having family here, is becoming the most draining. She says, if I fill up being with friends and being social, what suggestions do you have? All we have done are mini golf on days it's not busy, a couple days a week, going out for frozen yogurt. But it sounds like in this particular person's case, that desire, that need of an extrovert to get energy from friends and family is really limited right now. Any advice there?
That's a tough one.
I think this is where it's such a personal choice, right? Because the hospital worker in me is like, we all need to stay apart, stay safe, right? We just need to let this ride out. But I also work with kids. Before coming here, I worked with a lot of children. I had children myself. I also know how important some aspects of social interaction are to their development and how detrimental, and especially for kids that might be less flexible to transitioning because this situation is taking away so much from them. That's when I think it becomes a really personal decision as a family. But I think there are ways to try and be smart about it, right? And one of those ways might be cohorts, right? Might be, okay, I've got this extrovert kid, and this is what we know about our family. We haven't traveled outside of the area. We keep masks on when we're out in public. We wash our hands. And I also happen to know this other family, and they're good friends, and they like to hang out with each other. And we need to sit down and talk to each other as the adults and say, okay, we're recognizing our kids are struggling. I think it would be healthy for them to be together. How are we going to get them together? How are we going to keep them safe? How are we going to communicate with each other so we can make sure that I'm keeping your family safe, you're keeping my family safe? I think we're going to see a lot more of these conversations as school, either opens on a modified schedule or maybe not at all. I think we're already actually seeing it. I believe that there's even a Facebook page opened up for the Truckee community on families interested in forming these little pocket cohorts where you can minimize risk but then, maybe get some of the benefits out of having kids together in appropriate spaces, being able to be spaced apart, when they're not going to be able to get that vital social interaction that they need in order to develop. And for extroverts, yeah, it's even harder. So I think we just need to think about, how do we get creative with it? What do we do?
Yeah, the themes I'm hearing in a lot of this is that creativity and communication are big ones, and learning to adapt and figuring out a way to do something you're not able to do anymore in this new environment, and that's that creative piece. So any final thoughts in terms of the topic in general? And then we'll take everybody, we'll stop the recording and take everybody off mute if they want to ask any questions. But any final thoughts going forward? Dr. Pritchard, if you want to start.
Oh, well, I wish I had some brilliant, brilliant remark. I'm just thinking, how creativity to embrace this new norm, look for these new opportunities to expand our skill sets, expand our tool chest, is what we're all faced with right now. So that's what change is always about: loss, letting go of the old to embrace the new, even as sort of oddly twisted and bizarre as it is right now. There must be a diamond out there hiding in the murk of this swamp that we're in, that we can all find inside ourselves and in our own lives. And I guess that's what I would say.
Thank you, Jonathan. Any final thoughts?
Yeah, just to kind of dovetail off that, I think that it's understanding that that we've been talking more recently, especially about some of maybe the positive things that we can do, but I don't want that to come across as ignoring all of the pain that we have maybe experiencing on different levels, and to know that it is going to be a mix of both. We are all in the shared experience of loss, for sure, at different degrees. And it's also okay during those periods of loss, if we're struggling, to try and navigate and do things. We're all actually going to have to do things in a different way, because nobody's practiced this yet. None of us have practiced in our lifetime or had a go-round with a global pandemic. We're all learning as we go. And to cut ourselves some slack, be kind to ourselves. Be good enough is good enough. Be a good enough parent, right? Be a good enough neighbor. Be a good enough, don't feel that if you're not taking this on with a smile on your face and pep in your step, and you've decided to write that novel you've been neglecting since college. That's fine, right? Just be good enough, and then be good to each other. And if you need help, reach out.
Absolutely. I want to add just one thing. Technology, I know a lot of us are getting zoomed out, but it is a blessing to have this. And working in health tech for a little bit while, I'm up on some of these things. There's an app called House Party, where you can play trivia, you can play word games, all kinds of games on your phone with friends and family all over the world, and you can actually be on FaceTime. So you're looking at each other while you're playing these games, and it's a lot of fun. So, and that kind of gets, back to the creative piece. But yeah, you can download it from the App Store. It's called House Party, and it's a lot of fun. Yeah. As soon as it starts snowing, we're going to be on things quite a bit.
And for the kiddos and the adults out there, another great one online is these online communities that are growing in terms of storytelling and role-playing games like Dungeons and Dragons. It's kind of made a little bit of a resurgence, and it is a fantastic way, again, to connect online, to tell stories, to work through struggles, and that can be a great one for kids and adults. But there's a lot happening out there.
Yeah, and we're definitely going to see more of that, I'm sure. Well, thank you both very much. I'm going to stop the recording in a second, but I did want to mention our next talk is on, oh boy, where is it? On the August 13th, We're doing Powering Up Your Parenting Skills, both with Jonathan, Dr. Pritchard, we have Peter Mayfield, we have a couple of the TTUSD school counselors. We have Rebecca Shirtliff, who's the director of our Talforce Child Care Center. So that is going to be a really a great talk. So, and the login is exactly the same as this one, but we'll make sure to get that out to everybody. Thank you again. Thank you both very much for doing this tonight, and thank you all for attending. And I'm going to go ahead and stop the recording and unmute everybody here.